I'm a hematologist, a clinical hematologist. I've been taking care of sickle cell patients for over, 3 decades now, and I think I'm in the right place or position to be able to talk to you between what I used to see before and recently, the past 1.5 years, with my new experience with the new discovery, oxygen concentration machine or home oxygen therapy or early home oxygen therapy. That's one of the, mainstay in the protocol, the management protocol of sickle cell disease. And it's been a wonderful experience. And I used to have so many sickle cell patients in my clinic, not less than 15 in a month. And they come in, of course, sickle cell patients working, they don't work in, they come in crisis. And they, of course, we always try to do our routine things, analgesic, rehydration, and the place and try to find out the cause, treating malaria, and of course giving antibiotics and so on and so forth. We found out that no matter what you do, the crisis lingers on for a few days and before going. And they found out that depending on what the cause is, they might have a need to be admitted in several occasions or most of the time. But recently, when I just stumbled on the website and I read about Dr. Sota, the discovery of oxygen therapy, and over the years, I've known that oxygen plays a very important role in the management of sickle cell disease. And, whenever they come in, we always put them on oxygen. And we found out that the effect we expect actually, it's just like a gradual effect. And later I got to know most of the time that this oxygen at the time we applied them in hospital does not actually, stop the pain, because whatever that has been responsible, that is responsible for the pain is already in existence, and the oxygen cannot take care of it until the body takes care of the cause, which we already know. And I don't want to go into the pathophysiology of sickle cell crisis, but we've discovered, that low oxygen tension plays a very important role in sickle cell disease over the years, and that has insisted our use of oxygen. But the challenge we have been having is actually we have been applying the oxygen at the wrong time. But when I saw this I read the article, on the discovery, I see that it's something that has to do with timing, that actually these sickle cell patients can, sickle cell, sickle red blood cells can actually be reversed, when they sickle under low oxygen tension. That if you're able to get to them within the first 30 minutes, about 30 minutes to 1 hour, actually reverse them back to their normal shape and they begin to function normally. And that was the main point I saw. And actually I started, of course, in the hospital environment, you cannot use it. You cannot achieve that kind of thing. And so what I'm trying to do was that we're trying to encourage some of my patients to acquire it, and they did. And at the end, they were able to, I noticed that they were getting results. They were getting results, telling them each time they felt like had the symptoms of, had the, kind of felt like they wanted to have it, they should use oxygen at home. And they did. And I found out that their hospital visitation reduced drastically. And even when they came in a situation where we could manage them easily, and they would just go home that same day. And frequently I noticed that the number dropped and eventually even zeroed. And the only ones I still see now are the ones that are not able to acquire the oxygen therapy appliance. So it's been a very wonderful experience, and I tell you it's great, and that I've been part of this. And frankly speaking, my role, because I now have a very few of them in my practice. I try to do things, as part of the humanity services, being the platform, helping all the warriors, all the sickle cell patients all over Nigeria, all over the world, and contacting me, try to help them get the right oxygen concentration, oxygen therapy appliance, and helping them to also use it at the right time and the right quantity. And they have been wonderful all over. And sometimes when they, some of them, get crisis and they visit the hospital, I help them to also their doctors to take care of them effectively, to make sure they are taken care of successfully. And I've been doing that over the years pro bono, not for fees. And they've been wonderful results. And some of them who always want to rush to the hospital and, after during any crisis, they end up not going to the hospital anymore and calling on me, see me managing sickle cell patients remotely, having a remote management, effective remote management of this, which is successful. So they won't go, they see them not going to hospital anymore, just calling me. I say, okay, do this, and do this. And they get well with the oxygen already on the ground, they're already on the oxygen. I will not tell them what to do again, just add this. And they get well. Unlike before, they would have ended up in the hospital and would spend days. And we've also found out that the patients are now better. Most of them are crisis free. And they are not necessarily crisis, but the frequency has reduced, hospitalization has reduced, blood transfusion has reduced. And more people who are benefiting more here, especially the teenagers who are now entering university. With the portable oxygen concentration machine, most of them that are used to, drop out during examinations, and the testimony has been that they all end up taking all the exams, without falling sick because of this oxygen application. It's been wonderful. But I follow them up wherever they are pro bono, or they all have my number. They call me up, and I can, specifically testify the efficacy of this oxygen therapy. And I want to advocate that every doctor should give it a try. It's not a time to make argument. The oxygen is not just what you think. Just use it, and you'll be able to know, you have the experience. So there's nothing to say that this is difficult. Some people have said so many things. I know some of the patients calling me, telling me that doctors are refused to use it, say it doesn't work. But you have not given it a chance. Or so not necessarily it doesn't work. Some of them said that it's not true, it's internet medicine, and some of it. This is not internet, it's real. And so I want every one of us, especially my colleagues, to try and use it. We are the second responders. Now with this oxygen, they are the first responders. The patients are now the first responders, and they see them doing well with it. So I want to encourage everyone. It's been a wonderful experience, and I thank God, that I'm able to witness this in my practice, this new discovery, and it's something that's very, very efficacious. And once you apply it at the right time and at the right dose, and you get the right, the right therapeutic result. So I advocate, and I want to recommend it to everyone. Thank you very much, and God bless.